For many of us, the coronavirus pandemic was the biggest challenge of our lives. But Scotland also faces another public health emergency, and that is drug-related deaths. And we can and we will do so much more to prevent people in our communities from dying. Earlier this year, I set out the Scottish Government's new national mission to both save lives and to improve lives by promoting recovery and reducing the harm caused by drugs to individuals and their families. We made a very firm commitment of £250 million, including £100 million investment in residential rehab and aftercare services to increase capacity and develop rehab services on a regional basis too. And all of this will sit alongside good community-based interventions as well as primary prevention. The SNP manifesto made 3 new commitments. Firstly, to ensure that there are outreach services in every local authority area. Secondly, to implement new treatment standards in the first year of the next Parliament to deliver same-day prescribing or treatment, essentially ensuring that people get help when they ask for it. And thirdly, we will move towards 5-year funding for grassroots and third sector organisations, because these are the organisations that are at the forefront of saving lives. The SNP also remains committed to overcoming the legal barriers to introducing overdose prevention facilities. We know from the evidence around the world that this is an approach that works both to save lives but also to help people into longer term treatment and support. And we will also continue to pursue an evidence-led review of UK drugs legislation, although my preference would be for these powers to be within the competence of the Scottish Parliament. And our work to reduce drug-related deaths will also be joined at the hip with our work to improve mental health services, which will see an increase in direct investment of 25% if the SNP is re-elected. And all of our work to save lives and to improve lives will be shaped by real life experience. And at its very heart, there will be compassion, dignity and respect. Thank you for listening.